Perfect, that's right. Testing, 1, 2. Understand. Yeah.
I was in my 20s when I had my first seizure, and I woke up, and my husband at the time was crying. And I said, "What's wrong?" He said, "You had convulsions. You had a seizure." And I assured him that it was a bad dream. I told him, "No, honey, you had a bad dream. Go back to sleep." I have had a history of what we thought were panic attacks for years and years. So I didn't connect the two. I didn't realize that this was also epilepsy. And come to find out, I was misdiagnosed. Finally got a specialist and went to the neurologist. He'd prescribed medication. They started me on a regular dose, a regular medication. At that point, these focal auras, I still had issues with that. It was not controlled by the medication. When I told my neurologist that was when he prescribed VALTOCO. I have my VALTOCO in my bag at all times with me so that I can catch it immediately and take the medication. I think that people might be more familiar with allergies and with asthma. So I can take my long-acting allergy medication every morning, but in the moment that I'm having an asthma attack, I need that inhaler immediately. Similarly, I can take seizure medication every day, but if one of those focal seizures pops through, I need to take the VALTOCO. I need to use the sprayer immediately. Everybody has the different triggers and so on. For me, it really is the stress, maybe lack of sleep and that kind of thing. But there's other times where I have no idea where it came from. Mitch is very aware of my symptoms, and when I'm having a focal seizure, he'll make sure that I've got my bag and make sure that I have my rescue medication. After a tonic-clonic seizure, I self-administered. So just having it close by, that would be my best advice, is just have it close by. And if someone else is going to administer it, then make sure that they understand what to do and how it works.
I think that we move quicker and we move as a team now. I think that if she feels as though she may have a seizure or that something's not right, she tells me and I have something I can do about it. She's more upfront with me. I feel like she says something and I have a reaction, I have a plan.
I thought that I was being strong. I thought that I was being fearless by enduring this seizure or focal seizure without taking medication. Come to find out, my doctor later told me that I was actually doing damage to myself by not taking the medication, because the more the brain seizes, the more the brain is going to seize, because it learns how to misfire, and those pathways just start to spider out. You need to have that sense of urgency. My best advice would be to take the VALTOCO immediately when you feel like you're having an aura or the beginning of a focal seizure. If you're capable of self-administering, do it immediately. Have it with you at all times. If you're a caregiver, then have some kind of a code word or know the signs. When you start to feel that tickle, that little bit of an aura or that focal coming on, that you can yell artichoke or something. And then, the mom or the caregiver or whomever is alerted immediately to grab the rescue sprayer.
I would call it an intervention. And just something that when she feels she's going off the rails, this is the thing that gets her back on it. She knows she has something that can help her if she feels something coming on, or to help her recover from that. So she's been less worried when I'm going away for a couple of days. That's probably the biggest thing on our family dynamic that's different.
VALTOCO gave me back the confidence to go anywhere and know that if I do have a focal seizure, that I can take care of it right away. I don't have to leave the party. I don't have to go home from work. I'm taking care of any particular or any potential aftershocks. Call it aftershocks, but clusters is the best word. After I take VALTOCO, that sense of relief is immediate. VALTOCO's changed my everyday life because I now have more confidence. If a seizure was right in front of me, I would say, you don't define me. I might not be able to get rid of you, but you are not me, and I am stronger than you in the end. Give Seizures the sprayer with VALTOCO.
What is VALTOCO? Diazepam nasal spray. VALTOCO is a prescription medicine used for short-term treatment of seizure clusters, also known as episodes of frequent seizure activity or acute repetitive seizures that are different from a person's normal seizure pattern in people 2 years of age and older. VALTOCO is a federally controlled substance, C4, because it can be abused or lead to dependence. Keep VALTOCO in a safe place to prevent misuse and abuse. Selling or giving away VALTOCO may harm others and is against the law. Tell your healthcare provider if you have abused or been dependent on alcohol, prescription drugs, or street drugs. It is not known if VALTOCO is safe and effective in children under 2 years of age. Important safety information. What is the most important information I should know about VALTOCO? VALTOCO is a benzodiazepine medicine. Taking benzodiazepines with opioid medicines, alcohol, or other central nervous system (CNS) depressants, including street drugs, can cause severe drowsiness, breathing problems, respiratory depression, coma, and death. Get emergency help right away if any of the following happens: shallow or slowed breathing, breathing stops, which may lead to the heart stopping, excessive sleepiness, sedation. Risk of abuse, misuse, and addiction. There is a risk for abuse, misuse, and addiction with benzodiazepines, including VALTOCO, which can lead to overdose and serious side effects, including coma and death. Serious side effects have happened in people who have abused or misused benzodiazepines, including diazepam, the active ingredient in VALTOCO. These serious side effects may also include delirium, paranoia, suicidal thoughts or actions, seizures, and difficulty breathing. Call your healthcare provider or go to the nearest hospital emergency room right away if you get any of these serious side effects. Use VALTOCO exactly as your healthcare provider prescribed. Physical dependence and withdrawal reactions. Benzodiazepines, including VALTOCO, can cause physical dependence and withdrawal reactions, especially if you use VALTOCO daily. VALTOCO is not intended for daily use. VALTOCO can make you sleepy or dizzy and can slow your thinking and motor skills. Do not drive, operate heavy machinery, or do other dangerous activities until you know how VALTOCO affects you. Do not drink alcohol or take opioid medicines that make you sleepy or dizzy while taking VALTOCO until you talk to your healthcare provider. When taken with alcohol or medicines that can cause sleepiness or dizziness, VALTOCO may make your sleepiness or dizziness worse. Like other anti-epileptic drugs, VALTOCO may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call a healthcare provider right away if you have any new or worsening suicidal thoughts or related symptoms, especially unusual changes in mood, behaviors, thoughts, or feelings. How can I watch for early symptoms of suicidal thoughts or actions? Pay attention to any changes, especially sudden changes in mood, behaviors, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Call your healthcare provider between visits as needed, especially if you are worried about symptoms. Suicidal thoughts or actions can be caused by things other than medicines. If you have suicidal thoughts or actions, your healthcare provider may check for other causes. Do not use VALTOCO if you are allergic to diazepam, have an eye problem called acute narrow-angle glaucoma. What should I tell my doctor before taking VALTOCO? Before using VALTOCO, tell your healthcare provider about all of your medical conditions, including if you have asthma, emphysema, bronchitis, chronic obstructive pulmonary disease, or other breathing problems. Have a history of alcohol or drug abuse. Have a history of depression, mood problems, or suicidal thoughts or behavior. Have liver or kidney problems. Are pregnant or plan to become pregnant. VALTOCO may harm your unborn baby. Are breastfeeding or plan to breastfeed. VALTOCO passes into your breast milk and may harm your baby. Talk to your healthcare provider about the best way to feed your baby if you use VALTOCO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use VALTOCO? Read the instructions for use for detailed information about the right way to use VALTOCO. Use VALTOCO exactly as prescribed by the healthcare provider. Your healthcare provider will tell you what seizure clusters are, exactly how much VALTOCO to give, when and how to give VALTOCO, what to do after you give VALTOCO if the seizures do not stop, or there is a change in breathing, behavior, or condition that worries you. You should carry VALTOCO with you in case you need to control your seizure clusters. VALTOCO is given in the nose, nasal only. Each VALTOCO only sprays one time and cannot be reused. Do not test or prime the nasal spray before use. Each dose of VALTOCO is provided in an individual pack. Use all of the medicine in one pack for a complete dose. What should I do after I give VALTOCO? Stay with the person after you give VALTOCO and watch them closely. Make a note of the time VALTOCO was given. Call for emergency help if any of the following happen. Seizure cluster behavior is different than other seizure clusters the person has had. You are alarmed by how often the seizures happen, by how severe the seizure is, by how long the seizure lasts, or by the color or breathing of the person. Throw away, discard the used VALTOCO. If needed, a second dose may be given at least 4 hours after the first dose, using a new pack of VALTOCO. Do not give more than 2 doses of VALTOCO to treat a seizure cluster. A second dose should not be given if there is concern about the person's breathing, they need help with their breathing, or have extreme drowsiness. Do not use VALTOCO for more than 1 seizure cluster episode every 5 days. Do not use VALTOCO for more than 5 seizure cluster episodes in 1 month. What are the most common side effects of VALTOCO? The most common side effects of VALTOCO include feeling sleepy or drowsy, headache, nose discomfort. These are not all of the possible side effects of VALTOCO. Call your healthcare provider if you experience any side effects following administration of VALTOCO. You may report side effects to Neurelis Inc. at 1-866-696-3873 or to FDA at 1-800-FDA-1088. Please see prescribing information and medication guide.